morning, dear students. I am Dr. Lamia Musli, lecturer of Medical Microbiology and Immunology, Faculty of Medicine, Ain Shams University. Today, we will perform the steps of hygienic hand rub using alcoholic preparation. It's important to know hand hygiene well as the back of your hand for your work later on, whatever your specialty is. Always remember that clean hands save lives, so please concentrate. You have to know that there is 3 ways to wash your hands. First, routine hand wash, mainly at home, using plain soap and water. Second, hygienic hand antiseptics, using hygienic hand wash or hygienic hand rub. The third way is surgical hand antisepsis, which is used mainly before surgical operations. Today, we will perform steps of hygienic hand rub using alcoholic preparation, which is the same steps of hygienic hand wash, but with some differences that we will explain later on. First, remember to remove any jewelry or watch that you are wearing, because it's difficult to remove any antimicrobial agent that may be stuck to them. The first step in hygienic hand rub is to put adequate amount of alcoholic preparation in the palm of your hand according to the size of your hand, usually 5 to 10 milliliter. Then, the second step is to rub your hand palm to palm, spreading the disinfectant agent all over your hand. In the third step, rub the palm of your hand against the dorsum of the other hand with interlacing finger and vice versa. The fourth step, rub palm to palm again, but with interlacing fingers this time. Then, rub the back of your fingers with the palm of the other hand with finger interlocked and vice versa. After that, rotational rubbing of the thumb against the palm of the other hand and vice versa. Then, rub the tips of your finger in the palm of the other hand with vice versa. Kindly notice that it's important to have your nail cut short for your health, as the microbial agent can find its way easily under your nails if they are long. Also keep in mind that nail polish can stack microbial agents, so avoid nail polish is a must for hand hygiene. The last step is to rub the rest of each finger with the other hand. Then leave your hand to dry. Now your hand is dry and safe and clean. Kindly notice that you don't have to do the steps in the same order as I do. However, it will be so easy for you to do it in this order for better remembering, and by that you won't forget any step. Also make sure that each step take about few seconds so that all the steps can be done in about 40 to 60 seconds. Regarding the difference between hygienic hand wash and hygienic hand antisepsis, first, hygienic hand wash is essential if your hands are visibly soiled or visibly dirty, so hygienic hand rub can't be done. Also, at the beginning of your work, hygienic hand wash must be done. Also, if you are dealing with a patient suspected of having diarrhea due to organism having spores, so it's a must to wash your hands using hygienic hand wash. Always remember, spores can never be removed by alcohol, and so hand wash is a must. Hygienic hand rub is indicated if your hands are visibly clean. Another difference between hygienic hand wash and hygienic hand rub is in the steps. In hygienic hand wash, you must wet your hands with water at first, and in the last step, you have to dry your hand with a single-use towel, then close the tap using this towel. In hygienic hand rub, don't use water or towel. So, we discussed the steps of performing hygienic hand wash and hygienic hand rub. Always remember that hand hygiene is very important. It's one of the main standard precautions to reduce the risk of transmission of microbial agent, both from recognized patient and unrecognized patient in healthcare facilities.
There are 5 moments of hand hygiene according to WHO. They are the key moments where the healthcare personnel should perform hand hygiene. First, immediately before touching the patient. Second, before performing clean or aseptic procedure. Third, after body fluid exposure risk. Fourth, after touching a patient and before contacting another patient. and lastly, after touching patient surrounding. Thank you, dear students.